Welcome to the Mental Health Reform Podcast. Here on Mental Health Reform, we believe in starting important conversations, breaking down stigma, and highlighting the incredible work of those who dedicate their lives to making a difference in the mental health space in Ireland. Today, I'm very happy to introduce our guest, Philip Watt, Interim CEO, to speak on the recent developments in Irish government and politics and how that will impact mental health reform in Ireland for all of us. Philip, it's great to see you. It's been a busy week in the government.
Yes, we were delighted to hear of the appointment of Mary Butler to a role as Government Chief Whip with responsibility for mental health. Minister Butler brings a wealth of experience in her previous role in mental health and older people. And it's also great to see that her position is a super junior minister. So that means that she will be attending cabinet meetings, which is definitely an upgrade from the previous level that role was in. And we also know that the chief whip will have primary control over the government's legislative agenda. So I'm sure the minister will be very committed to ensure that the mental health bill will get passed as efficiently as possible.
The newly formed government recently launched their programme for government. What priorities and policies does it outline in terms of mental health, and how will it promise to tackle this pressing challenge in Ireland today?
There's important commitments in there, and particularly a very strong focus on children and young people, which is really to be welcome. The CAM services had a particularly strong focus, but what's really important is the overall strategy, which is sharing the vision. And there's been good progress on that strategy over the last few years. And going into quarter one and quarter two of this year, a new implementation strategy will be developed. So we'll be talking to our members about participation in that and ensuring that sharing the vision is going to be as effective as possible.
So you spoke of some positives. Are there any areas that were lacking for you, or any detail that you would have liked to have seen?
I think with all programs for government, it's really good in terms of setting out the ambitions, and indeed, there's over a page and a half on mental health issues, which is fantastic. But all programs for government tend to be a little bit weak on time scales and definitive benchmarks about progress. So, we will certainly be seeking a meeting with the minister and the department and the HSE to continue to ensure that the good progress that has been made in recent years continues. There certainly needs to be more resourcing in the voluntary and community services. And, the whole issue around the government's commitment to funding Section 38 and 39 organisations, the commitment to an 8% increase has to be fulfilled. But also for organisations who don't get that kind of source of funding, funding from elsewhere, there's a need to ensure that our services are sustainable. So to ensure that they get adequate funding to continue their work.
And how can people listening today engage and ensure that the newly formed government keep to their commitments?
Well, in a number of different ways. Certainly, we'll be playing our role to work in partnership with the government to ensure that the key commitments are fulfilled as much as possible. The individual member organisations of mental health reform are very powerful as a collective voice and individually as well. So get involved in an organisation that is in your area. Continue to raise issues around the importance of investment in mental health, both for adults and for young people, is really, really important. Ensuring our understanding and commitments to issues such as suicide prevention continue, to ensure that minority groups are included in services such as the migrant communities and the travel community is really, really important as well. So the only way we can get these things across the line is with the support and solidarity of our members and people who support mental health reform.
Philip, thank you very much for sharing your thoughts today. Really appreciate it.
Thanks, Steve.
You will find this podcast with others soon to be broadcast on mentalhealthreform.ie. Our site also includes a vast repository of policies, research, and up-to-date mental health supports in your area. So please take a look and tell us what you think.